Hey SmartPak fans, I'm SmartPaker Dan. She's Dr. Lydia Gray, SmartPak staff, veterinarian, and medical director. And we're here to answer horse health questions asked and voted on by you. Now, for some of you who might be new to Ask the Vet, we do want to kind of give you a little bit of a sneak peek. There's going to be a fun little surprise at the end of this video, a little update for our next episode. So you're going to want to stay to the very end to find out what that is. Do you know what it is?
Maybe.
We were going to wait till the end to find out then.
Yeah, I just said the whole thing.
Apparently I haven't told her and I feel bad about that, sorry. But also, fun update.
Okay.
So for those of you who know, if you ask a question for Ask the Vet and it gets voted into the top 5 and gets answered in one of these videos just like this, you win a SmartPak gift card. And we have increased the SmartPak gift card to $25.
All right.
So you can definitely put that towards your horse's supplements or get yourself something nice. So definitely make sure you start some of those questions so you can take advantage of that.
Yeah,
you can
nice.
do some good stuff.
We're so generous.
But let's get on to the lucky
Sure.
winners for this month. So question number 1 was asked by Megan on our blog at blog.smartpak.com. And Megan wants to know what plants are toxic to horses. So I know in the past we've done videos about what fruits and vegetables,
Right.
which we'll put a link in the description for you guys so you can check that one out. So I am curious to see what plants are.
Oh, so the short answer is pretty much everything. There's hundreds. And this book is quite old. It's Horse Owner's Field Guide to Toxic Plants. But
The name says it all.
yeah, it's a wonderful book. I think I got it in either undergrad or vet school. And I use it even now. So it's quite old. And there's also, the author, Sandra Berger, used a resource. His name is Anthony Knight, and he's recognized as one of the gurus of toxic plants in animals, especially horses. So great resource, and he has written or been interviewed for many articles in magazines, and I picked one in Equus a couple years ago where he listed the 10 most poisonous plants for horses. Okay, so I want to read through that. Those are the ones to keep an eye on mostly. So bracken fern, and I can add some tips about each, like must consume hundreds of pounds of it, which normally wouldn't be a problem, except this is one of the few poisonous plants that horses find tasty.
Why is that? Why does nature do that?
It's not fair. So number 2 was poison hemlock, where 4 to 5 pounds is a lethal dose for a horse. And then tansy ragwort, also known as groundsel. It's again in the 50 to 150 pounds, but it's cumulative.
So they would have to be out in that area for a while.
Over time.
Consuming that.
Yeah. Something in my area, Johnson grass or Sudan grass, it's a sorghum variety, but only when it's damaged, wilted, trampled, frost.
Okay.
Yeah.
So
Like the red maple leaves, which is on here too. Only a pound or 2 of those can be toxic, but it has to be wilted leaves. So in the fall when the leaves drop or after a storm.
So that's when they're the most toxic.
Yeah. Red maple leaves on the tree are toxic. It's after they're
wilted and fallen off.
Yeah. Loco weed, oleander, now that's an ornamental.
Yeah.
And it only takes 30 to 40 leaves. Another ornamental, and this one I have a lot where I live, is yew, or Japanese yew.
Okay.
It's a bush planted around houses. And you're like, how do horses get access to that? Well, what happens is, and here it's only a handful, only a few leaves can kill a horse. When people or landscapers trim the bushes, and they're like, oh, horses. And they throw it over the fence, the clippings, and then the horses eat them.
They think they're doing something good every time.
Yeah, that's how it happens, so you gotta be careful. Water hemlock is on there, and yellow star thistle, which is also known as Russian knapweed. So those are my list of 10.
Is there something people can do to find out if they have these things on their property? Because I'm a super hypochondriac, so now that you've told me this, I will assume everything in the area is now toxic.
So I wrote also an article. Could you hold this one up?
I absolutely can.
Yeah. It's a really good article in Dressage Today, and what's the date on it? Can we see the month and year?
2016, March 15th, 2016.
So this is the issue you want, and the article mentions things about who to contact in your area about the poisonous plants, because poisonous plants, I mean, like all plants, they don't grow, most of them, throughout the U.S. They're areas like the dry southern Southwest U.S. or in the cold northern climates, or maybe a plant only grows in Florida or something. So talk to your veterinarian, and if he or she doesn't have the resources right there, what you'll do is work with your local vet school or university, and the county extension agents are a great resource. They know exactly what plants are in your area, what to watch for.
So you can see if anything matches up to what's on that list, and then if you have it in your property.
The other tip is, because most poisonous plants aren't very palatable, horses avoid them, except when they're hungry.
And then they'll eat anything.
Well, yeah. So when I was in practice, every July, August, so every summer, fall, we'd have an outbreak of white snake root poisoning because pastures would dry up or the horses would eat them down, and then they were hungry. So they would, this plant's found on the edge of a pasture in the woods. They would go further and find the only growing plant, which was white snake root, which ordinarily they wouldn't eat, but they were hungry.
Yeah.
So if you can keep your pastures in good shape and your hay in front of you, like when pastures are not looking good, then supplement with hay. So keep your horses full,
so
and
then
they
they're
won't
not
seek out
those other
things they normally wouldn't eat. So, but the other thing I wanted to tell you, so we got the important stuff out of the way, 10 most poisonous plants and a few tips. My husband is a veterinarian too. You knew that, right?
Yes.
And he's a small animal vet. And he's interested in snakes and toads and frogs and amphibians. So he's what's called a veterinary herpetologist.
Yeah, you guys have a couple snakes, right?
We do, we do. So every once in a while someone asks us, are your snakes poisonous? Right?
First question that come out of my mouth.
Yeah, and he reminds me that snakes are not poisonous, snakes are venomous. Do you know the difference?
I do not.
I did not either, and I forget, and so I'm reminded by him every year. So, poisons are toxic substances secreted by plants or animals. Like there are those poisonous dart frogs of somewhere, Brazil or something. Okay, venom is injected, so you have to be bitten. So there's a little, if you bite it and die, it's poisonous.
If you bite and die, it's poisonous.
If it bites you and you die, it's venomous. So there you go.
That's the fun tip fact for today.
Yep.
That's a good way to remember it.
You may need that, who knows, tomorrow.
Hopefully not. Well, Megan, hopefully that helps you out and stay clear of the snakes. But on to question number 2, and this was submitted by Audrey on Horseback on YouTube. Great name, Audrey. She wants to know how to help a horse with sore back muscles, alternative therapy, stall rest, exercise.
Right. The first thing I would say is you got to work with your vet and make sure that your horse has sore back muscles, right? My friend and colleague and Olympic veterinarian, and I think he's also the chair of the USEF Drugs and Medications Committee.
Oh.
Yeah, pays to know good people.
Yeah, seriously.
Dr. Kent Allen. He has this great quote, and it's absent a diagnosis, surgery is trauma, medicine is poison, and alternative medicines are witchcraft. So his point is get a diagnosis. Yeah, because a sore back can be a primary condition or it could be a secondary condition.
Symptom of something else.
That's right. And if you can work on the back all day, but if you don't treat the underlying cause, the back will continue to be sore.
And sometimes I think people feel that they'll spend less money by, oh, I'll just do this or that. And
it's the other way around.
Yes, you end up spending more.
And time.
Yes, over time, versus just spending the money, finding out what it is, and then treating that and being done with it.
The other things that are important is there is on our website in the Horse Health Library a really good article called Horseback Pain, and you could find it under the joint and lameness category. And it says, there's a quote, the majority of back problems are bony in nature, but they're always combined with soft tissue damage. So if you've ever had a back problem, it may have started with a bony, like a herniated disc or something with your spine. But then your muscle goes into spasm. All right, that's the issue.
Where you can't move your neck.
Because once your muscles go into spasm, it doesn't matter almost if you fix the bony underlying problem, you got to release that muscle tension. Yeah. So we brought a couple things. There's that one. There's a Back on Track here. There's the Rambo.
So yes, we have the Rambo Ionic Stable Sheet.
Yeah, and this is the
The Benefab.
Benefab Rejuvenate Smart Scrum, ceramic and magnetic. So there's a couple of these that can help you or help your horse when you've got that diagnosis and you know what the primary problem is, and these might get you back to performance, help you, rehabilitate the horse and get him back to where you need to go. But so the bony in nature, like what do you think of when you think of a bony in nature back problem, kissing spines?
Yeah, absolutely.
So you got to make sure that that's not going on. But there's some other things that maybe you don't think of that can also lead to back pain, like saddle fit.
I was just going to say.
Okay, yep. Rider imbalance. So the saddle can be balanced, but the rider cannot be balanced. Even certain disciplines, poor conformation, lack of adequate shoeing, like the shoeing and trimming is not quite right. They're not conditioned for the work they're doing, and therefore they get sore. And then even a poorly fitting blanket. You've heard the ones that pull down on the withers, and they wear them all winter, and then they're sore.
Well, it's like if you wear something that's like too small and like you can't move in it, it just stiffens everything up. Yeah.
So as far as other therapy options, ones that your vet might recommend as you're working through the treatment, they can inject steroids into painful joints in the area, just like they do for your legs, your hocks, or whatever. Non-steroidals like bute, Banamine, Equiox might be prescribed. There's muscle relaxants to help break that cycle of spasm. There's something called mesotherapy, and this is where it's a device. It's tiny injections into the middle layer of the skin. It's a pain dampening technique. And so the middle layer is called the mesoderm, so then it's mesotherapy.
Okay.
Yeah, so that's common. And then the alternative therapies, I think, would be like chiropractic, acupuncture, massage. There's therapeutic ultrasound, and all that. There's some hormone therapy that can help improve muscle tone.
Okay.
If lack of tone is the issue.
Would that be like for more senior type horses generally?
No, not necessarily. It all depends on what the primary issue is. Shockwave therapy can be used. And then I think she mentions rest. Like she says stall, rest, or exercise. I found an article and the title says it all. It says, time heals, but good care helps. Layups benefit from an accurate diagnosis, healing nutrition, proper therapy, and patience. 30 years ago, if you broke your leg, this is a quote from Kent Allen, you sat in your butt until it healed. Today, you're in therapy almost immediately, right? They keep you moving, and they tell you, even with human back pains, the worst thing to do is to rest or to lay in a bed.
Because then everything stiffens up even more.
Yeah, you get up and move around. And it's the same in horses. But again, and I really feel like I'm harping on this, you've got to have that diagnosis. You've got to make sure that what you're dealing with is something that's going to be okay with movement. Yeah. And then let your vet, who may refer you to a rehabilitation, a vet board certified in rehabilitation, let your vet set the program of what needs to happen, like what kind of movement and for how long and how many days in a row. Because for some things, work might be beneficial. Other things, work might be detrimental. Yeah, and some things, activities you want to do every day, and some you want to skip a day. So there needs to be a program developed by your veterinarian and maybe a team of healthcare professionals. And I do love that you mentioned saddle fit, because that is one where I think we all make the mistake where we just put the saddle on, assume it's good, and over time of having that incorrect fit, it does create some issues in discomfort in horses. The horse's back changes, the saddle changes, the rider changes, so yeah. We do have actually a bunch of videos that we just filmed for Ask the Saddle Fitter. Yeah, they're very, very good. They're very great, so definitely check those out. We'll put some links in the description so you guys can kind of take a look at those as a resource. The last thing I want to mention before I forget is one of my favorite books. It's maybe my second favorite book. It's by Dr. Hillary Clayton, who I've mentioned before, and Narelle Stubbs. It's called Activate Your Horse's Core, Unmounted Exercise for Dynamic Mobility. My horse and I are both going to do some core exercises. Strength and balance. They found exercises, they've proven by research, they've done, these are published studies, that certain like carrot-baited stretches can not only stretch out the horse, but strengthen muscles that might be unused and horse just forgets they have them, like many people do, and don't use their core. So we get the horse, we remind them, you have these muscles, use them, and then it helps them with kissing spine or other back problems. There are some really cool exercises out there for horses to do, carrot stretches being one of them, the pull work, things like that to really get them engaged certain muscle groups. So
Absolutely. Well, hopefully that helps you out. That's a lot of great information, but definitely get your diagnosis and then go from there, and hope you guys will be back to riding soon. So then question number 3 was submitted by Equestrian Videos on YouTube, and they would like to know, my horse has arthritis really bad in the winter, but in the summer seems fine. Is that okay for me to ride, or is it okay for me to ride more?
Right.
Sorry.
So you know what the first thing is I'm going to say?
Get a diagnosis.
Get a diagnosis.
I'm noticing a trend for these videos today.
Let's just make sure that what you're dealing with is arthritis, and that get your vet's approval, permission, okay. Make sure they're on board with you, that they're on the same page. If they might have a reason why in your particular situation, maybe, I can't imagine, but maybe it's not appropriate.
Yeah.
Maybe, you know, movement's usually always good, not stall rest, but maybe riding is unsafe. So I would say use some common sense too. If there is a safety concern, then maybe just doing things on the ground with your horse is all that's, like in the winter when your horse feels particularly bad, maybe that's all you can do. And then in the summer, maybe that feels better enough to actually have you sit on them and go somewhere. Because they do like to have a job.
They do like to have,
you know?
mentally keeps them engaged.
Yeah.
So go back, get the diagnosis, and then see kind of where your horse feels most comfortable, and kind of listen to him.
And that's the thing. You're getting ahead of me here. I had another quote. So one is, try something, and if the horse gets better, it's probably good for him. Common sense. And then, ironically, in this age of science and imaging, the expression of the horse is still the best guide to providing care. So the point is, listen to your horse. Let them tell you what you're doing, what you're asking me to do is too much, or I can do more, Mom, or that, like maybe walking over ground poles is too much.
Yeah.
You know, you think, oh, that's good exercise, it's stimulating to the mind, the body, but maybe that ask to bend and to lift is too much, and maybe so they're sore the next day. That's them telling you,
let's not do that again.
Yeah, but you have to be creative, and so there's lunging, there's long lining, what might be called ground driving, and there's patterns. There's association. One of the Western Dressage Associations has competitive patterns that you can use for to be interesting.
Change things up a little bit.
Yeah, of course I'm a big fan of clicker training.
Yeah, yes you are.
I think you can do some groundwork with and without obstacles. That's always fun. Hand walking is good for both you and the pony. But some tips are, take the low impact. So jumping is probably out, barrel racing, anything with fast starts and fast stops and quick turns, and those kind of things are, speaking from experience, can be painful to joints and things. Take your time warming up and also warming down. And this is something I learned a long time ago with any age of horse. Tell me if you do this. I hand walk them before I get on.
I would love to say that I do. How long? Like from the cross ties to the arena?
No, I don't walk a horse from cross tie to the arena and get on. I'll do like one lap each way and then get on.
I do a little bit because I do take my time with the girth. I don't like to so a little bit like that.
So like you do a lap and tighten the girth and do a lap. Okay, and be regular and consistent. So especially with these kind of horses, a little bit, 15-20 minutes every day is better than 2 hours on every weekend, every Saturday.
I think we all kind of get into like that weekend warrior mode because of jobs and all that stuff. So
avoid long layoffs. It's really important to check saddle fit in the older horse because their top line can go quickly, and then your saddle needs adjusted. Make sure that the hooves are in good shape. So some people, when their horse is retired and maybe they pull shoes and they're like, oh, I'm just going to have his feet down like every 3 months. No, they probably need hoof care more often.
Well, the thing is, as we've spoken about before, if the feet aren't landing correctly, it throws off how they move and how their joints are working and all that. So it just kind of like has a ripple up effect from there. And
back to the veterinarian, the thing we didn't mention is your vet may, when he or she is guiding you, and yes, you can exercise or no, you can't ride or whatever, they're also going to design a program for you that involves movement, maybe some prescription medications, and then they're going to pair that with a joint supplement, which if your horse is retiring from competition, the joint supplement might change. There might be things that you couldn't include in there, like herbs or whatever, when you were showing, but now you have access to them. It doesn't matter. But It can be fun because you look at your joint supplements and there's the traditional ingredients, like the glucosamines and the chondroitin sulfates and that. And there's some newer ones now. I think we have one. There's a resveratrol, turmeric is trending, collagen. So you can play around a little bit with see what your horse does better on. And horses are individuals like people. They're going to respond better to some and not others. We don't all respond to the same thing the same way.
And what's cool about some of those ingredients that you mentioned is not only specifically good for like joint health, they can be good for overall health in general.
That's right. Yep.
More bang for your buck.
Right. Good. Yeah. So.
Perfect. Well, on to question number 4. So this is submitted by Dana on our Ask the Vet form at smartpak.com/askthevetquestions. And Dana wants to know, my horse has been diagnosed with pain and arthritis of the SI joints. She's starting him on Equiox. She's just curious if taping the joints would actually provide any relief. Does taping work for pain, or is it total nonsense? Good question, Dana.
Yes, it's right to the heart.
Yeah.
I didn't feel comfortable answering this, so I asked our good friend and consultant, Dr. Andy Canitz.
Ah, Andy.
And he signed the email and he got back to me, Andy Canitz, DVM, and I'm like, oh no. So he has a PhD. He's a diplomat of the American College of Veterinary Surgeons, and he's a new diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. So see why I asked him this question. Okay.
He's also a friend of Ask the Vet. We've done a couple episodes with him, so he's got some great resources.
I wanted to make sure that everybody's on the same page. So she asked about SI, so that's sacroiliac. So that's the joint in the pelvis, like behind the back and the hips. And then there's something else she said I want to make sure that she's starting with Equiox. Oh, Equiox. Yep. So that's a non-steroidal anti-inflammatory. It's firocoxib, and it came out first in dogs as Previcox, and then they released it as they relabeled it as Equiox in horses. And I talked to a tech services vet from that company, and they pronounce it Equiox, like equine. So I'm like,
Equiox.
Maybe
that makes more sense.
I don't know. It does kind of. But it sounds Equiox sounds better. Anyway, this is what Dr. Canitz said. Kinesiotaping was introduced for treatment of people in 1979.
Okay.
I didn't realize. In the last few years, taping techniques and equine-specific tapes have been introduced. Have you seen them?
I have seen them.
Kinesiotaping is thought to act on skin fascia, which is the connective tissue around muscles themselves, joints, and the lymphatic system. It can be used to activate or inhibit muscle activity depending on how much stretch is applied during the application. Have you seen them put on?
I have not seen them put on. Okay. When I went to the NRHA Derby a few years ago for SmartPak, it seemed to be a lot of people were doing taping.
You should try to watch a session. It's pretty cool. Tape application is also thought to stimulate pain receptors, possibly reducing the sensation of pain. Unfortunately, there are few research studies that objectively evaluate the effects of taping in horses. No. In a study conducted in Austria, the effects of taping on horse muscle was evaluated. No differences in muscle activity or limb motion were found when taped and untaped, so treatment and control were evaluated. The researchers were well trained in the use of kinesiotaping in both humans and horses, so they're very adept at the techniques. And we can put that study up on the screen too so people can read it themselves. So researchers have not reported on the effects of kinesiotaping for controlling pain in horses.
Okay.
This study does it affect movement?
Yes.
Okay. There are other methods, here's the good news, of treating sacroiliac discomfort. So non-steroidal anti-inflammatory drugs, such as what she started, a good choice for treatment. Another method is to inject the SI joints with anti-inflammatory medication. Pain in the SI region may also be reduced with laser therapy or shockwave therapy. Improving core strength and flexibility with specific exercises.
Seems to be the answer for everything.
Wonder whose book that would be, Dr. Hillary Clayton, are also valuable for treating and preventing SI and back soreness.
Interesting. Okay, so she sounds like she's off to a great start with the Equiox. Sounds like she's probably working with her vet if she has that prescription.
Because it's a prescription, right?
Yes. So after that, taping, it doesn't sound like...
Well, just because one study from Austria says that one study could not find difference in movement between taped and untaped does not mean it doesn't work. It just means there needs to be more studies, and he specifically pointed out there's not been a study to date on its influence on pain.
So it could almost go back to your earlier point where you have to read your horse, and if it's something you do and your horse seems to be improving by it.
If your horse likes it, do it.
Maybe it's something you keep
There's
on
a lot
doing.
of therapies that I do on my horse that have no proof, but he likes it, so I do it.
I feel like he's your own little research study.
He is, yeah.
Well, awesome. Well, Dana, if you do try the taping, let us know how it works out for you and your horse.
Yeah, send us a picture. That's pretty cool looking stuff.
Yeah,
so, some
absolutely.
horses, and the tape is very bright, bright yellow, bright blue, bright pink.
Well, you have to make it fun.
Yeah. So, yeah, send us a picture.
All right. Well, on to our last question. This is submitted by Nikita on YouTube, and Nikita wants to know, how many types of colic are there? So we answer all kinds of questions on colic, so we'll definitely put the link in the description here and at the end of this video for you. But this is a great question, because I think this is when people get hung up on a little bit.
They do, and it's there's a number of ways to look at this. Do you think we should define colic, or is that in other videos and they should?
That is in other videos, but I think it might be a good way to anchor us here a little bit.
Oh, okay, good. So colic is plain and simple. It's defined as abdominal pain in horses. So it's not associated with it's not associated even with the GI tract, and for sure not in any particular segment of the GI tract. So it's just pain in horses, and it manifests as, and I think one of the other videos has a rolling list of pawing and rolling and looking at the flank and maybe going up and down and sweating and high heart rate. And
well, I think people think sometimes colic has to be this huge episode or scene. It is literally could just be pain in the stomach and banging the stomach. It doesn't have to be.
And I suspect we don't know of a lot of colics that happen in our horses that are overnight or out in the pasture when nobody's watching them.
I totally agree with that.
So we've covered all the signs and symptoms, and the risk factors I think are in a video too. We also cover what to do and what not to do, like hand walking for hours and hours and hours. There's no benefit in that. You can look at colic as you mentioned, mild, so medical colics that are treated, either not treated, because they were that mild, they went away on their own, or they were treated on the farm, like one visit from the vet, just some Banamine, and maybe they tubed the horse and it was all fine. Or the ones that the vet comes to the farm and treats the horse, and they are able to stop the pain for a while, and then in 30 minutes it comes back. And those are the ones that, particularly if you have CustomerCare, the colic surgery reimbursement program, you get referred to a surgical facility, and surgery might be
which is the worst when they're like, is your trailer hooked up? You're like, okay.
Is there gas in the truck?
Yeah.
So medical and surgical are two types, but I think what the person was asking was what causes colic.
Okay.
So there's the AAEP has a wonderful PowerPoint presentation and a brochure on their website, and they classify colic 3 ways. Intestinal dysfunction, which would be the most common one, and those are the mild medical ones. Then intestinal accidents, and those are things that can only be corrected by surgery, so those are more severe.
Twists and things like that.
Yep, and then inflammation, ulceration, and those are named by the segment that is affected. So if you have diarrhea of the large intestine, it might be a colitis, or of the small intestine, it would be an enteritis. So that in there would be stress, medication, parasites, sand, and infections. Back to the intestinal dysfunction, those mild ones, those are your spasms, the gas, like a gas colic.
Yep, you hear that one a lot.
Yep. Impactions fall under that because those might be able to be resolved with mineral oil or that's less favorable now, just putting fluids into the gut with the stomach tube is been shown to be better at resolving impactions than mineral oil. We used to think that oil would go around the impaction and sort of soften and smooth out.
Yeah.
It's better to put fluids in, and they get into the impaction and soften it from the inside out, and then it just dissolves, it breaks up, and then it passes.
A little new tip for all of us there.
In intestinal accidents, so those are the surgical ones, can be things you mentioned, twists and entrapments. There's one where entrapment where the right dorsal colon flips, it displaces it. It goes over the ligament between the spleen in the kidney, and it gets stuck there.
The horse's anatomy, it really can do some
I know, I
crazy
think
things.
it was designed by committee, so that's really good. There's also one called intussusception, and it has as many S's in it as you think. And that's a telescoping, so that a segment of bowel telescopes into another one. And once it does that, it doesn't usually come back out, so that's also surgical. That's not as common.
These are quite scary.
Yeah. So.
But these are things that, you know, unfortunately we have to deal with as horse owners, and there's all kinds of things that can happen with them.
Right.
And colic, unfortunately, is non-discriminatory towards horses. It can really, unfortunately, happen to any of them.
Yep.
And that's why we do programs like CustomerCare to kind of
Yep.
give people a little bit of reinsurance of peace of mind that if they do have to make a decision,
We're
have
behind you.
have some options there for sure.
Yeah.
So hopefully that helps you out and did not scare you too much. But that is it for this episode.
Okay.
That was all the questions. Thank you guys so much for taking the time to submit all these questions. These are some really great ones
They
for
were good.
sure.
Very
this
practical.
month. Yes, very practical. And so our little surprise that we were going to mention,
yeah.
I almost forgot about it. So next month we are taking Ask the Vet on the road again. So we did go to T&T Equine a few months ago. That some of you might remember.
That's right.
This time we're not filming in front of a live audience, but we are going to one of the local barns here in this area.
So we're filming in front of live horses.
Yes.
Okay.
They won't judge us if I mess up, hopefully. Well, maybe more. So definitely watch out for that one because it should be a ton of fun. It's a beautiful farm, so it should be a great one.
Great.
So you definitely want to keep asking questions, so we have things to answer for that video. You can ask your questions on YouTube, Facebook, Instagram, Twitter, the SmartPak blog, and our forum at smartpak.com/askthevetquestions. Just make sure to use hashtag AskTheVetVideo. And if your question was answered in this video or in a previous one, make sure
$25.
get your $25 gift card by reaching out to our customer care team at customercare@smartpak.com. So until next time, make sure to subscribe and have a great ride.